As children, we are completely dependent on our caregivers for our survival. To our young brains, this means life or death. So we don't have to be abandoned physically as children for our brains to fear death and trigger extreme survival neurochemicals in our systems. It can be emotional abandonment. For example, if you grew up with an alcoholic or other addicted parent, they would have been emotionally unavailable as their primary relationship was with their substance or process addiction of choice. To a child, this creates extreme anxiety as it means life or death to their yet fully formed brain, which may manifest in the child as separation anxiety and will most likely manifest in the adult as abandonment issues. Because the subconscious mind, 1, doesn't understand time, 2, is our inner protector, and 3, is dominant over our rational, logical, conscious mind, if there is perceived abandonment for the adult, and this can be as innocuous as your partner not getting back to a text on time, depending on how unhealed the abandonment wounding is, then the abandonment wound can be triggered, which feels nothing short of a full psychological and physiological body hijack. Symptoms can be total shock, feeling completely winded or gutted because we feel the abandonment wound in the stomach, panic, feeling like a shell of yourself, and other flight, freeze state symptoms. Now, this can be very confusing and frightening when you don't know what it is, especially as it can feel so out of proportion to the trigger, e.g. someone not texting you back. The most important thing to do when abandonment terror is triggered is remind yourself that it's an old wound and that you are safe. The good news is that the more you work on your abandonment wounding with an experienced therapist or practitioner who understands this fully, the more it can shrink, and the more you can safely manage any triggers and reassure your system and your mind that the threat is actually firmly in the past.